Now, the Ministry of Interior's National Government Administration officers will be on the government's front line in the push to register Kenyans into the Social Health Authority ahead of its rollout next week. Now, the officers will use the same approach that they used to register 6 million farmers into the subsidized fertilizer program. The collaboration between the Ministry of Interior and that of Health comes as the government sets to enroll 12 million households into the National Health Coverage, or rather Universal Health Coverage program during the first part of its implementation. Let's get more from our very own Brenda Wanga.
Five days to the rollout of the Universal Health Coverage through the Social Health Authority, and the government is pooling resources together to get the critical mass required to make the program operational. The network, presented by the Ministry of Interior through the National Government Administration officers, has now been activated.
I am persuaded, just the same way we, through Ngaos, supported very efficiently the registration of farmers for the distribution of fertilizer, where we enrolled over 6.5 million farmers in record time and saved the country hundreds of millions, or is it billions actually, which had been proposed by consultants. I am persuaded beyond doubt that we will deliver the registration of universal health coverage in record time and at minimum cost to the government of Kenya.
The Ministry of Interior has availed its officers right from the sub-locations to the 8 regions. They will be charged with the responsibility of coordinating the registration of Kenyans for UHC. They will be expected to take advantage of the network coverage spanning 8 regions of 47 counties, all the way down to over 9,000 sub-locations to encourage Kenyans to register en masse.
The reason we are here today, because of the tremendous work, the tremendous experience, the good connection, the prompt sensitization that you have been able to do at down at community level. We really need your expertise. We need to leverage on your platform so that we can sensitize, inform the community about the benefits.
And it's easier. And between the 106,000 elders and the 106,000 or 110,000 CHPs, I think this is a team that will deliver this thing in record time.
The Ministry of Health aims to register 12 million households, translating into at least 38 million people into the SHA. Already, 1.6 million people have been registered. The Ministry of Health maintaining that the registration into Sha isn't optional.
That is a very important reason for registration, and that's why we are putting it as mandatory. I'm still saying it is mandatory because we are implementing the act as it is.
But as the push for the registration gathers steam, the government is also calling upon its officers to help fight what it terms as misinformation that could threaten the public's buy-in of Sha.
The message has not reached quite well. The coverage is not good. At the higher level, there's a lot of things going on in social media that may change the vision of Kenyans. They will not understand that this is for their benefit. We need you to inform them that Sha is for their benefit. They need to register so that they can access care.
The two ministries now say they will work together to ensure that the provision of UHC, one of the government's key agenda, is successful. Brenda Wanga, Citizen TV.
All right, Brenda, thanks so much for that.